Hey there, it's Lowell Wild Jr. So we're entering the end of September. You need to start to think about how you're going to close out the year really strong. And what I've found is towards the end of the year, there's an opportunity to call your patients back to get the care that they need that is only provided on a yearly basis. For instance, diabetic shoes, orthotics, things that insurances cover every year in many cases, and you want to call your patients back and to remind them, hey, it's 2019, you haven't gotten your diabetic shoes this year, come on back and get them before the end of the year, before your opportunity expires for this year. Same thing with orthotics. Many insurance companies cover orthotics 1 a year. You want to let your patients know all about it. And there are other things that you might think about, vascular testing, and maybe some other things that I'm not immediately remembering. Another thing you want to remind your patients of is if you've met your deductible, you may want to maybe have the surgery that you've been putting off, maybe buy the orthotics that you've not been ready to do, maybe the injection of amniotic or placenta tissue that is expensive, but now that the deductible is met, they want to pursue. So you want to be thinking about these things as the year comes to an end. And the way we strategize and do it is we actually create a list of patients who are qualifying for those things. And our call center gets on the phone and calls them and says, hey, Mrs. Jones, you haven't gotten your diabetic shoes in 2019. You want to come in and get them. And it's amazing how many patient visits we can generate and provide the care that the patients need. Not just to generate revenue, these are things that people need to get better, to help their foot problems, to help their overall health. So what I would say is put a strategy in place, start to execute it, don't wait too long because the year is coming to a close much quicker than you think. And in fact, with the diabetic shoes, you actually have to deliver the diabetic shoes in 2019 to qualify for 2019. So you need to start that process really soon. So start getting on this, think ahead, and make sure that you're ending the year really, really strong. I'm Lowell Wild. Have a great week.